More than 68 million Americans rely on Medicare for their health insurance. That's according to the Centers for Medicare and Medicaid Services. But figuring out when to enroll and which coverage is right for you, that can be a bit confusing. In fact, missing your enrollment window could mean paying penalties for years. And that's why we're joined this noontime by Health and Medicare Insurance Advisor Brianna Henward, who is going to walk us through step-by-step process of Medicare and hopefully take a little of the confusion out. So thanks for joining us.
Absolutely. I love being here. Yeah. So with Medicare, there is this confusion of what it is.
Yes.
Medicare is this federal health insurance that you pay into your entire working life.
Okay.
So if you or your spouse has paid in for 10 years or 40 quarters, then you unlock this Medicare at age 65 or after being disabled for 2 years.
Okay, so that's a key one. The age thing is very important. When can you sign up? Is it okay, my birthday's today at noon, I can sign up? When does that process really start?
Absolutely. So if you turn 65, say my birthday is March 7th. So the year I turn 65, my Medicare can start as early as March 1st of that year. So you don't have to wait for the full year.
Okay.
And then your sign-up period, your window to get enrolled, is 3 months before the month you turn 65, the month you turn 65, and the 3 months after.
Okay.
So it's a pretty good
That's
window.
a good window of time to do it.
But if you don't know the details,
right,
you can be confusing. And you do have the option, if you're still working and you have employer coverage, you get to pick. You get to put Medicare versus your employer side by side and pick the one that's strongest for you.
Okay. Benefits financially, how that all shakes out, what works for your family.
100%.
So this is my terminology, not yours, but I feel like Medicare can feel a little bit like vegetable soup or alphabet soup. There's a lot of terms and linguos. So we want to walk through kind of the different brackets.
100%. Yeah, so Medicare is a completely different form of health insurance. It's strong, but it's broken up into different parts. So Medicare Part A is your hospital inpatient insurance.
Okay.
So it has no monthly premium, which is great. It can have copays and deductibles, but no monthly cost. Part B is your outpatient, doctors, so thinking getting outpatient surgery, seeing your specialist, getting chemo. That does have a monthly premium. So Medicare is not free. So that one is $202.90 for most people in 2026.
Okay. Even there are some variations, I imagine.
High income earners and low income earners can pay differently. So the low income earners, main care, Medicaid, state-based insurance based on your income can jump in. And if your income is in six figures or above in different brackets, you can pay more for your Part B.
Okay, so this is why I was saying there's a lot of letters and parts involved, and there are more parts to get to. We'll be talking a little about those in our next half hour and getting kind of the nitty-gritty, because as you were mentioning, there's the main care and Medicare part, which also becomes a factor to consider as well. So we'll be talking more with Brianna in our next half hour right here. There's something called Medigap. Also Advantage, terms that we hear thrown around, but what do they mean? And what do you do if you don't yet qualify for those? If you're nearing retirement, what are the other health insurance options? We'll be talking about all of that in our next half hour starting at 12:30 right here, so we hope you stick around for that.